Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Tanjuatco-Trillo, sitting in for Pinky Webb. Today on the program, a health official calls the spike in COVID-19 cases alarming, and is the South Africa variant situation getting out of control? And later, more tourist destinations are opening up to boost the economy, but with the threat of new COVID-19 variants and a rise in cases, how is the tourism department recalibrating its strategy? And it is International Women's Day. We pay tribute to women leaders amid the pandemic. Health spokesperson Rosario Vergeire and Tourism Secretary Berna Romulo-Puyat join us live. Experts are sounding the alarm over the surge in the number of new COVID-19 cases in recent days. Octa researchers say the more infectious new variants of COVID-19 might be playing a role in the rapid spread of the virus. Our Zian Arcangel tells us more.
The Octa research team warns COVID-19 cases in Metro Manila could reach 3,000 daily by the end of March. The group's analysis of data from the health department showed an average of 1,025 cases were recorded in the National Capital Region from February 28 until March 6. That's 42% more than the average number of cases recorded daily a week prior to February 28. And more than double the average recorded in the first few days of February. Octa Research Fellow and Professor Guido David says the United Kingdom and South Africa variants of COVID-19 might possibly be playing a role in the surge of cases.
Nasasabi natin to kasi yung rate of infection mas mabilis pa ngayon kesa nung December, mas mabilis pa ngayon kesa nung July to August last year na nagkaroon tayo ng crisis. Doon sa dating virus na kilala natin, yung original virus, hindi siya ganito kabilis mag-spread.
David says it's crucial to slow down the increase of COVID-19 cases in Metro Manila to avoid a repeat of the situation in July and August last year when hospitals were overwhelmed with patients. Octa Research currently considers the cities of Pasay, Makati, Malabon, and Navotas as high risk due to their attack rate or percentage of people who contract the virus.
Posible talaga may exceed natin itong numbers na nakita natin noong August kung hindi natin ma-reverse yung trend. Kaya importante ma-reverse natin trend.
While researchers don't recommend placing Metro Manila again under a strict Enhanced Community Quarantine or ECQ, David says the government must be more aggressive in implementing localized lockdowns. David also urges government officials to study protocol for travelers arriving in the Philippines from abroad.
Baka pwede natin gawin mas strict ulit yung protocols. Kasi ngayon, for example, isang example lang, on the 5th day, pwede kang magpa-test na PCR. Kanyari, pumasok ka sa bansa, pag nag-negative yung PCR test mo, pwede ka na makalabas.
Researchers say it's too early for the public to let its guard down, even if COVID-19 vaccines have arrived. Everyone still needs to practice minimum health standards and stay home if possible to avoid contracting the virus. Zian Arcangel, CNN, Philippines.
Now let's go straight to the source of the story. Health spokesperson and Undersecretary Rosario Vergeire joins us. Yusek, good morning. Thank you for being here.
Good morning, ma'am.
Okay, Yusek, the rising COVID cases in the Philippines, the past 3 days, we've breached the 3,000 mark. How concerning is this for the DOH?
Again, I did not hear you quite well. I'm sorry.
All right, ma'am. Over the past few days, the Philippines has breached the 3,000 new cases a day mark. How concerning is this for the Department of Health?
We had been trying to prepare for so long already for this kind of situation. Like before the Christmas season came in, we already had several talks with our hospitals for us to prepare for this kind of event. And now that we are seeing that there is this rise in cases, we had several meetings with the mayors already, with local chief executives, and also with our regional directors in our hospitals. And we have instructed them to prepare. And we are seeing right now that our healthcare utilization still can accommodate patients who may come in. Our local officials are now given instructions and we have collaborated with them that there should be these localized responses across the areas where there should be more visibility of our enforcers so that we can remind people to continuously comply with the minimum health protocols.
Ma'am, to what can we attribute this spike in cases? Is it the South Africa variant or the UK variant?
We just like to clarify that a lot of people in their minds, it would be the direct cause would be the variants that we had recently detected. But we need to be informed and we need to understand that the minimum health protocols compliance would be the foremost in our response. So if people would start being complacent and they are not following the health protocols, and then cases would rise. The detection of the variants is just an aggravating factor, but basically the underlying cause for this all would be the compliance of people to minimum health protocols.
All right, so those are still so important no matter what variant is out there. But the point is the cases are rising. Would you say this is the start of the second wave? Dr. Tony Lechon says it is the second wave.
Again, I'm really sorry, but I'm having gaps with
Yes.
I can't understand.
All right, no problem. What I was asking, Ma'am, is this surge that we're seeing right now, is it the second wave? Dr. Tony Lechon feels that it is.
We would like to veer away from classifying this marked increase in cases as having a surge or having a second wave. What we are saying right now would be that there is this marked increase in the number of cases and that people has to be very, very cautious and that local governments have to step up with their response.
All right. Earlier, ma'am, I spoke to Dr. Del Rosario of PGH. He said of the 30 samples they submitted of healthcare workers from his hospital, one came back as a South Africa variant, and I believe 52 more cases were recorded last Friday. Can you tell us, ma'am, how many more samples are under analysis?
Well, we have this analysis that we do every week wherein we receive about 750 samples coming from the different regions of the country. Last week, we had this run where we did it purposively, where we have targeted specimens or we have targeted individuals who were positive in the National Capital Region, in Region 7, and different returning overseas Filipinos coming in the country. So last week we had a run and we were able to detect this number of variants for South African and UK variant. For this week, we are going to continue on with our regular sequencing where we are going to process about 750 samples across the country.
All right. With these 52 new cases of the South Africa variant, can we say, ma'am, that there has been community transmission or not yet?
We still need to verify because if we say it's community transmission, we need to have that evidence where we cannot link any of these cases we cannot link these cases anymore. But for now, we are still seeing linkages but of course, we are still verifying some of them if there really are linkages. So for now, we cannot declare that there is community transmission of these variants.
All right. Still on the topic of the South Africa variant, would you say that controlling the South Africa variant is a daunting task at the moment, given that it is said to be more transmissible?
I'm sorry, I'm really sorry, but I did not get the question.
Yes, that's all right. Would you say that controlling the South Africa variant is the most daunting task at hand for the DOH right now?
If I got your question right, controlling the variants would have an effect on vaccines. Would that be the question?
Yes. Well, is it how daunting a task is it for you to control the variants at this time?
Well, it's very critical for us to control the entry of these variants or the spread of these variants because, as we know, this variants has higher transmissibility. It can cause higher transmissibility, and therefore, these variants may cause an uptick or the increase in the number of cases. But as I've said, if only people will be compliant to our minimum health protocols, and we can be able to control the increase in the number of cases, and therefore these mutations of this virus and these variants may be controlled as well. So let us keep the cases low so that the mutations of the virus would be at the minimum, and the variants would not spread that fast, and will cause the rise in the number of cases.
Ma'am, do you feel that here in the country we've become a little lax with maintaining minimum health standards? Yes, Yusek, can you hear me?
Yes, ma'am. I'm not getting you. I'm really sorry, but my connection is really poor.
All right, that's fine. I can repeat the question for you. Do you think that in the country, in the Philippines, we have become more lax when it comes to carrying out and enforcing minimum health standards?
Yes, we have noted that for this past weeks that our behavior is more towards being complacent. We are assuming that people has this quarantine fatigue, and we are also assuming that people has imbibed in them this situation where they have adapted that this is part of their normal lives already. So that's why we are continuously informing and educating our population that we still need to continue with these minimum health protocols. It is really not enough of saying that we need to wear the mask. We need to remind people that you wear the mask, but you wear it properly, because oftentimes you will see people wearing masks, but it's on their chin, it's here in their ears, but not really covering their nose and their mouth. We have to go back to the objectives why we have this kind of interventions, and that is really to prevent the spread. If you wear your face shield on your head and not covering your face and your covering your face, your nose, and your mouth, and then all of this would go to waste. So we need to be able to communicate to the public that it is really not enough that you wear your mask and you wear your face shield. You need to wear it properly. It is not enough that you do physical distancing. You have to ensure that when you go to a place, there's no gathering, and there's no the persons within that place is not that much, and there is adequate ventilation. It is not enough that you wash your hands. You have to wash it for 20 seconds or more. These are the things that we would like to communicate and educate our public so that we can continuously prevent the rise in the number of cases.
Right, ma'am, of course, there is this question coming up now because of this surge that the quarantine status might be changed. Is that an option to go back to ECQ or MECQ? A lot of mayors have said they don't want to do that for the sake of economy. If we don't do that, what options do we have?
Well, for now, we are not contemplating on having this region-wide ECQ as what we had before. If you may observe, and what experts had been telling us, this is not the only measure that we can implement for us to prevent transmission. So when we had the meeting with the mayors, it was agreed on that there would be localized responses, and these would be intensive responses. They'll have, just like having these localized lockdowns that they're having right now, specific barangays, specific sitios, and also doing this visibility that their enforcers are there so that they can remind people to comply with the minimum health protocols. And most importantly, our local governments have to step up in their gatekeeping indicators. There should be appropriate and adequate testing, quarantining immediately within the 24 hours period, or this golden period, so that we can be able to prevent the transmission of this disease.
All right, thank you so much for your time this morning, Health Spokesperson Maria Rosario Vergeire. Coming up,
Thank you.
More tourist destinations are opening up to visitors, but how will the recent spike in COVID-19 cases affect the Tourism Department's strategy? Tourism Secretary Berna Romulo-Puyat joins us live. You're watching The Source on CNN Philippines. Our guest today, Tourism Secretary Berna Romulo-Puyat. Secretary, so good to have you here on the show. Good morning.
Good morning, Ria, and good morning to everyone watching your show. And happy International Women's Day.
Absolutely. Happy International Women's Day. I'm going to ask you a little bit about that later on in the show. But for now, the reopening of more tourist sites, you have Palawan, which is now opening up to tourists. How will this boost the local tourism industry?
Yeah, you know, Ria, under a modified GCQ, tourism should be already open, but it's only now that some of our tourist destinations have decided to open up. Well, those that are already open since last year are, of course, Boracay, El Nido, Coron, Baguio, Ilocos Norte, Ilocos Sur, Bohol, Siargao. But it was only last week that Siquijor and Darwin, Dumaguete decided to open. And for March 15, Puerto Princesa and San Vicente will also be open. It's been a year. 1 year, no work for our tourism stakeholders. And what they've been asking for from the LGUs is to reopen. So we're quite happy that most of the LGUs already have decided to reopen so that we can give back jobs.
Yeah, it's so crucial. Apart from the places that you mentioned, Boracay, Palawan, Bohol, what other tourist destinations do you want to see opened within the year?
All under MGCQ. It should all be open because by the mere definition, if you are under an MGCQ, it means that your cases are low and leisure is already accepted. So, of course, I understand that some of the LGUs are quite worried that the entry of tourists might bring in COVID, but we have already proven, we've already opened up a lot of our main tourist destinations, and no COVID outbreak because of tourism. Because most of the LGUs actually ask for tests before travel. So that's already a deterrent. You cannot enter if you're COVID positive. And we in the Department of Tourism, we continually remind our travelers, please, even if you're negative for swab or saliva, please always watch or have minimum health and safety protocols, wearing of the mask, face shield, especially if it's in enclosed places, physical distancing, stick with your bubble, stick with your family, and also wash your hands or sanitize or put alcohol every so often. So we always have to follow minimum health and safety protocols.
Yes, I was speaking to Yusek Vergeire earlier, and that's exactly what she was emphasizing. We can't become relaxed when it comes to that. Secretary Berna, can you tell us more about the recovery plan of the department? What is your long-term strategy to recover from the pandemic?
As early as June of 2020, we made the Tourism Response and Recovery Plan together with the private sector. This includes for the short term, of course, we already crafted all the health and safety protocols for accommodation establishments, tourist land transport, tour guides, etc. Those have already been crafted and those are already being followed by all the different accommodation establishments or those connected to tourism. So you cannot be accredited if you do not follow the health and safety protocols. And with Bayanihan 2, we were able to ask for what the stakeholders were initially asking for were for working capital loans. So under Bayanihan 2, we were able to get a lot. The Congress was able to allot 6 billion for working capital loans. Under Bayanihan 2, 4 years to pay, 1 year grace period, 0 interest rate. We also have, for the short term, financial assistance, 3.1 billion for all the employees of the DOT accredited enterprises, LGU license, and recently we were able to ask DOLE to expand this definition so we could give 5,000 financial assistance to all those working in tourist destinations. So that includes tricycle drivers, those that earn income from tourism. So it's not only limited to those working in hotels. That's for the short term. For the medium term, of course, we continue, actually ongoing even for the short term, we've already been marketing the Department of Tourism as top of mind. We even had 2 travel surveys already. And the first travel survey indicated that people will travel as long as 96% there are health and disinfecting protocols. That's why we've been stressing the importance of health and safety protocols because that's what will make people travel. Number two, our recent travel survey says that people want to travel, but 81% said that they are confused with all these travel protocols, the different travel protocols. So we were successfully able to simplify the travel protocols. So right now, when you want to visit a tourist destination, all you need is, if the LGU asks for it, is a negative COVID test, either swab or saliva. But we do away with all this medical certificate, PNP clearance, barangay clearance, etc. So it's already simplified. And now, right now, with the simplified requirements, when you go to a tourist destination, prior to this, some LGUs even ask for quarantine for 14 days. So now you do away with that unless you exhibit COVID symptoms. So we are continually revising all these protocols to be so that there will be ease of travel, so that people will travel. And of course, our main goal now is for more LGUs that are under MGCQ to please open up so that we can restart tourism.
All right, so basically the most basic requirement really is that you come into a tourist destination with a negative COVID test, and that's it, right?
Yes, basically if the LGU asks for it, yes, basically that's it.
All right.
So, yes.
So we've been experiencing this surge in cases of COVID-19. How big of a concern is this for the Department of Tourism? Is it going to change your plans or your timeline at all?
Even when we crafted all these protocols, health and safety protocols, this was even under ECQ. So our health and safety protocols are in place. It's quite strict. And you can only have tourism if you are under MGCQ, meaning your cases are very low or 0 cases. So that's what we will just continually implement the existing health and safety protocols, that even when you're negative for a COVID test, swab, or saliva, when you are in a tourist destination, you just follow the minimum basic health and safety protocols. It does not mean if you are negative for COVID that you can party and do away and do all your activities pre-COVID. You still have to follow the basic minimum health and safety protocols.
Right. Now, how much, let's say, autonomy do LGUs have when it comes to requiring quarantining, testing, and health certificates, as you said?
No more quarantine unless you exhibit symptoms. And the only thing that the LGU, of course, will ask for, it's up to them, is if there is test before travel.
All right, so that keeps it nice and simple, much less confusion if you are planning a trip. Secretary, I want to talk about vaccination. In your opinion, should tourism workers be prioritized as well?
Of course, of course. In fact, we were successful in including all the tourism workers working in quarantine hotels. As early as March 2020, our hotels have been open but working as quarantine hotels. And that's what we asked Secretary Galvez, if they should be, that they be included as first priority, because they are always exposed to possible COVID positive cases. So they are already in the priority, those working in quarantine hotels, all the employees. And I was already assured that right after all the first priority, of course, the first priority should really be the health, the doctors, nurses, healthcare workers, elderly, and of course, the tourism frontliners and those working in airports. We were already assured that after all of the priorities, it will be the tourism, because, tourism contributed 12.7% to the country's GDP. And those that were employed last 2019, those employed in the tourism sector were 5.7 million people. So definitely, tourism should really be prioritized. And we were assured that that the tourism workers would be prioritized.
Is there a schedule for their vaccination, Secretary?
Of course, after we get all the vaccine, after all the first priority is done, after all the first priority they've been vaccinated, we're already in the next list.
Yeah, Secretary, how possible is it that we will be welcoming foreign tourists in the country within the year?
Right now, we are already accepting balikbayans. That is our third largest market. It's hard to say, but we already have pilot. There are certain people who have been coming to the Philippines for work. For those who want to film in the Philippines, they are already accepted on a case-to-case basis. And as a pilot, to see how it goes, we are hoping that we can accept more. But right now, this is the situation right now. Actually, prior to the UK variant, as soon as they're tested negative, they are good to go. But right now, we have a 6 to 7 day quarantine. Actually, other countries, they actually have a 21 day or a 14-day quarantine. We have actually the lowest. It's 6 to 7 days. We're hoping as we go along, again, protocols are forever changing. We are always pushing for more tourists to come in with no quarantine, sana. But of course, we have to weigh this in. We have to balance this with what the health sector has to say. But of course, we want to push for more foreigners entering. But if you look at the country's GDP, we contribute 12.7% to the country's GDP. 10.8% are actually from domestic tourism. We accepted 8.26 million foreigners last 2019, but we had 110 million domestic trips last 2019. So for now, we will focus on our strength, domestic tourism, but we will be continually pushing as we go along, as we are able to handle this, as people are vaccinated, for more foreigners entering.
Right, certainly something we hope to see soon. Now, at the top of the interview, Secretary, you did mention it was International Women's Day. So I want to ask you, as a woman leader in one of the most badly hit sectors because of the pandemic, how do you manage to stay on top of the situation?
That's how women are. We know, women, whether you're in government or whether you're in the private sector or in the household, women are the leaders. We are the ones that hold the fort. So women, it has been proven during the pandemic, has proved to be a partner in nation building as a major contributor in economic growth. You know that most women now are actually working. And because to make both ends meet, to help the family, and women have been crucial. You know, Ria, when we were crafting all these health and safety protocols, the women were very influential. They were very important in all the protocols that we crafted. Maybe it's because women are more, I don't know, empathize. They always see what is good for everybody, for what is good for their family.
That's right. I love that. Thank you for sharing that with us, Tourism Secretary Berna Romulo-Puyat. We appreciate your time.
Thank you, Ria.
Good to see you. And thank you for joining us here on The Source. I'm Ria Tanjuatco-Trillo. You're watching CNN Philippines.